Hi, today we're going to talk about suctioning a patient with a tracheostomy. And before we get started, you want to make sure you explain the procedure to your patient so they're aware of what's going on. And if this is a patient that has had a trach for a little while, they're pretty familiar with this procedure. So let me introduce you to our patient. This is Miss Walker. She's a patient that has a tracheostomy. Hi, Miss Walker. How are you feeling today? Okay, good. Feel like you need to be suctioned? Okay. Remember that oftentimes our trach patients can't talk, and so you want to make sure you use very simple questions. Yes and no really works well. Lots of nodding. As they get a little stronger, they may have some more abilities to verbalize, especially if they have a little device that goes over their trach later on. But in the beginning stages, oftentimes this is not the time to ask them big open-ended questions. Keep it simple to yes and no. So first we want to gather our supplies. And you may have two different kinds of catheters. This kind that you'll probably see most often is a kit that has just the suction catheter and your sterile gloves. But you might also have a kit that includes some sterile water, and that's to help us clear the catheter of secretions. So if you have a patient that has a lot of secretions and you know that, you may want to bring a bottle of sterile water in with you with your regular kit. So before you get started, you want to make sure that you perform hand hygiene. And remember that suctioning of a trach is a sterile procedure. So setup is really important. So the first thing you want to make sure is that your patient has their oxygen on. And then we're going to walk over and get our suction equipment. So oftentimes your suction setup is on the other side of the room. So you may need to go over and get it. I like to go ahead and turn it on to continuous. And you want it high enough to suck out the secretions, but not too high as to cause damage. So, want to turn it on. And since it's on this side, we're going to give it a little try. So you can see I have some suction there. And then I like to put the tubing over where I'm going to need it. Now make sure you suction from the right side of the bed. So I'm right-handed, so I'm always going to be on the patient's right-hand side. Otherwise, when you use your dominant hand, you're crossing them and it can be a little confusing. So now I'm going to go over to the other side of the bed. All right, Miss Walker, we're going to get started now. Now, the patient should have a trach collar on for their oxygen administration. And so you want to go ahead and unsnap it and have it loose so you can get to the catheter and then put the oxygen back on. If your patient is cooperative, remember we want to start with some pre-oxygenation. Miss Walker, can I have you take a couple real deep breaths for me, just in and out while I get started, okay? If they can't do that, or they're a little obtunded or comatose, maybe on a ventilator, you might have to get an ambu bag and a partner to bag the patient a little bit prior. So now we're going to go ahead and open our kit. And you can see when I open up the kit, I have my catheter and my gloves all in one. So, going to open up our kit. Remember, this is a sterile procedure, so you want to use the good opening and getting your sterile field here, so only touch the outer 1 inch. The gloves that come in these kits can sometimes be a little difficult to use. Remember, I'm touching only the outside folded. And now I can go ahead and put my fingers under the cuff of my other sterile glove and put this one on. Now, sometimes it's kind of hard to tell where the thumb is, but as long as you use good sterile technique, you're all set. Okay, so I have my gloves on. I have my catheter here, and you be careful when you pull it out so it doesn't get contaminated. So I like to hold it like this, and then I have my sterile water. Now, this is kind of a single-use container, and so if I go and put my catheter in this water to clear it, I've got to throw this away when I'm done. So sometimes when you have these kits that have the little wells in them, it's really easy to pour just a little bit of sterile water in there. Or you can use a sterile specimen cup or something like that. Remember, has to be sterile. Now, to suction your patient, you're going to have a sterile hand and a non-sterile hand. And you need to make sure you're really familiar which is which. So typically, your dominant hand becomes your sterile hand. So now I'm going to use my left hand and I'm going to grab my suction tubing. So this hand is no longer sterile, but I'm going to connect my suction tubing to my suction. and then I'm gonna have the tip of my catheter controlled. This is the hand that you're gonna use to apply suction, and you don't wanna touch this catheter any lower than that. So you'll often see you wanna keep this catheter sterile, kind of holding it like this. All right, Miss Walker, we're gonna go down and suction you so you feel like you've had a good couple deep breaths. The need that I failed to mention earlier is a pulse ox, and you want to make sure you have a continuous pulse ox monitor on your patient to keep an eye on how they're doing during this procedure. Okay, Miss Walker, we're going to go ahead and suction. So with my non-sterile hand, I'm going to remove the trach collar, and you want to hold the catheter kind of close to the tip. Be mindful as you go in not to let the catheter touch their gown or any equipment. And we're going to go down until you feel a little bit of resistance and the patient starts coughing. And you want to kind of slowly come down, suction intermittently on the way out, and use a nice twirling motion, always moving your hand down the catheter to keep good control of it. And now you can see I have some secretion, so I'm going to come over here to my water, being mindful not to touch the catheter tip anywhere else to keep it sterile. In between suctioning, you can place the trach collar back over the patient and allow them to take some deep breaths. Do we need to go down again, Miss Walker? Okay, so I'm going to go ahead. Feel all right? All right, let's get started. So remove the trach collar, and again, we're going to go down until the patient coughs, being mindful that you have control of your catheter. Sliding your fingers down the catheter till you have good control. And you shouldn't be doing this any longer than about 15 seconds so we don't make the patient get too breathless. Keep an eye, good, we're still at 99%. Patient's doing okay. How's that feel? Do you feel like we got everything? Okay. Your patients that have been suctioned a lot know when it feels like they're clear. But I also don't want you to diminish your judgment. If the patient says they're feeling good, but you still hear a lot of rattles in their chest or don't feel like they've been cleared enough, you may need to go down another time. Ms. Walker, I'm going to go down one more time and make sure that you're all clear, okay? All right, here we go. Last time. Go down gently. There we go. Oh, yeah, just a little bit more there. Okay, very good. Does that feel better? Okay, so now I'm going to go ahead and clear out my catheter, and that's a really good idea. You want to get all that secretions out of your tubing so we don't have any bacteria buildup, and frankly, it's very unsightful to look at. When we're all done, we want to take this catheter and you're going to wrap it around your hand, disconnect it, and now my hand is no longer sterile, and wrap it up in your glove just like that. And then you can pull your other glove off afterwards. When we get all done, again, you're going to watch your pulse ox. Oh, you're doing great. Your oxygen level is 99%. Go ahead and reattach the band for the trach collar, and then we can move our suction out of the way. That's what we have, suctioning a patient. Thanks.